Oh, sweetheart. You got something stuck? All right. Something's really bothering her there. If she's got something stuck in her throat, it could be putting pressure on her airways, affecting the way that she's breathing. Anything stuck in the esophagus is also extremely painful. It can actually cause the tissue to die. It can be life-threatening. What is going on with you?
At the Bondi Veterinary Hospital, Kate's about to make a house call to treat 2 cats
Don't forget these masks.
that may have a deadly and highly infectious disease.
Cat gloves, just in case. I've never met these cats, so I don't know how cooperative they are.
Yes.
I've just had a call from an owner that has returned recently from overseas. She's tested positive for coronavirus and she's called because her 2 cats are showing respiratory symptoms and apparently they're quite sick. What's been most helpful, she sent me a video.
It's very annoying, isn't it?
So we have to get quite a few swabs. It's not just that one. We need to get like
there's a
good
lot.
sort of 4 swabs. Cats have their own form of coronavirus and that's usually what we call a gastrointestinal form. What we're talking about here, it is very rare to see cats that do get COVID-19. However, we do know that it is possible. Cat straitjacket, hopefully we don't need that. You got a thermometer?
Yes.
You've got
Gowns.
Great.
Good.
The cat's owner still has COVID-19, so Kate and vet nurse Kate are taking every precaution to ensure their own safety.
Before we get into that house, we need to make sure we are fully decked out in all of our protective equipment, all of our protective clothes, so that we make sure the moment that we step through those doors, that everything possible is protected. Okay, what the plan is, we're going to go get just 1 cat at one time, okay? And so let's just start with the easiest cat. Remember, we have to get swabs, so let's be as efficient as we possibly can. Okay. We walk in the doors, there's these 2 cats and I thought that they would both run away, but in fact they were so beautiful.
Hey, Jess.
Hello, beautiful. Look at you two. Got your kid.
Kate must be able to keep the cats calm to take some urgent samples.
First up, we've got Jessie. Jessie's the 10-year-old male cat. He's absolutely beautiful.
It's gorgeous.
He's definitely got increased respiratory sound on that chest. Good boy. Just checking for any nasal discharge in Jess. You can see here he's got quite bad conjunctivitis in his eyes. Don't you, buddy?
Good boy.
Okay, so Jess has also got a really large ulceration down the back of the throat here.
Kate is becoming increasingly concerned that the other cat, Beautiful, may have the same infection.
You're not feeling very well.
On the Gold Coast, Alex is urgently trying to find out what's causing 12-year-old Monty so much distress. The little fox terrier is struggling to breathe and is becoming extremely agitated.
Okay, I'm going to get her some pain relief, Jane. Jane, will you keep an eye on her while I go talk to her family? I'm really worried about that gagging.
The gagging.
If she looks like her colour's going a bit purple, anything like that, just get her on some oxygen. But if that pain relief helps, then we'll just let her settle down.
Owners Ian and Susan are anxious for any news.
Hey guys.
How are you?
Now tell me about what has been worrying you with her.
Well, she was sort of gagging and being sick last night.
Okay, so she didn't want to eat this morning?
Gave her a piece of chicken at lunchtime, but she just walked away from it.
She loves her food normally,
Yeah,
so
yeah.
she wouldn't turn chicken down usually?
No.
No. All right, I'm going to go see if we can get to the bottom of what's going on with her, and then I'll let you know.
All righty.
Oh, yeah.
Okay, thanks
Good day.
very much.
All right, take good care of her.
Yeah, okay, thank you. Oh, she's very important. Great little dog. I'm hoping they're going to fix her.
Hey,
Oh, you're right here.
This is Moni.
Hey, Monty.
I'm really worried about her. She's
been coughing and gagging.
Wow.
And she was really in a lot of distress before and she looked uncomfortable. She's better after pain relief, but I'm worried she's got something stuck.
What are your thoughts?
I'm thinking we do an x-ray.
Yeah.
Yep.
Gerardo has joined Alex to try to work out Moni's mysterious symptoms.
Oh, he's a good girl.
Good girl, Money. Okay, ready.
Take care. Is that something there?
Something puzzling is showing up on Moni's x-ray.
Why don't we stick some dye down there?
Yeah.
So this dye, despite the fact that it looks clear, and when we take an x-ray, it actually shows up as really bright white.
Good girl.
Wow.
Whoa, that is huge.
There is definitely something there.
How did that get down there? That's got to be like a big bit of bone that's stuck there.
The dye has highlighted this monster piece of bone here.
She was obviously coughing trying to bring it up, but there's no way she would ever get that piece of bone up.
That's not going to move by itself.
Yeah, we've got to get that out quickly.
You ready, boys?
Let's do it.
At the Australian Reptile Park, Tim needs reinforcements to help him with two very special but endangered residents.
Today we're introducing our pair of cassowaries, Cassie and Cooper. In the wild in North Queensland, there's less than 1,000 breeding pairs of cassowaries, less than 2,000 birds, which makes our ability to breed them all the more important. So we'll put those eggs in, just dummies. We'll try and trigger him, let him think that Cassie's dropped a few, let Cooper in, give him 5-10 minutes, and then we'll let Cassie out.
Sounds easy.
Timing is critical when it comes to breeding these magnificent birds.
If we're off by a day and they're not ready to mate, it can end in a fight.
Tim's plan is also extremely dangerous.
They've got an incisor on the inside of their foot that is capable of disemboweling a human. We like to spend as little time as possible face to face with the cassowary. See if she takes the bait, eh?
The first tricky job will be going into the enclosure to place the dummy eggs.
The purpose of our dummy eggs is to trick Cooper, or just reiterate that Cassie is ready to mate. Before we do that, we're going to lure Cassie into this holding enclosure so that she's not in with me. 1, 2, 3, bolt. Thought it wasn't going to happen for a minute there.
Cassie was no trouble, but will her potential mate Cooper be as cooperative?
I just want to test something. That's what I want to see. Look how gentle he is. Giant cassowary, and he's just so slightly touching that egg. That's perfect, because I'm hoping that soon he comes in, sees the eggs, and begins to do that. Maybe even flip them over, and in his mind, Cassie's ready to mate, and he's about to be a dad. So I'm going to sit them there and let Cooper in on the way out, and let's see what he does, and that might give us a few more clues that today's the right day. It's time to let Cooper into Cassie's yard. He's right there. Next is the dangerous part. Any time you set foot in with a cassowary, you're on. You have to be aware that in a split second that cassowary can turn, change behaviour, and be attacking you. It can be right on you, both feet up in the air, kick after kick after kick, and that won't stop when you go to the ground. Righto, it's go time now, Obes. Hey, hey, hey!
Near Bondi,
Good boy.
Kate is trying to find out if two much-loved cats are suffering from the deadly COVID-19 virus.
So what we're going to do is we're going to take some pharyngeals, so some swabs from the back of the throat, and we're also going to take some from the inner part of the eye. We need quite a few swabs as a just in case.
Good boy. He's a good man. Oh, I know.
Jesse is not very compliant. He's got a whole bunch of ulcers, so it must be really painful for him having swabs down the back of his throat.
Good boy. Good Jess.
I always say that never ever fight with a cat. You will always come off second best. So we're just going to have to see how this one goes.
Boy.
Good boy.
Oh.
A bit of TLC goes a long way.
Okay, well there's some material on there. Next up we've got Beautiful, and Beautiful is actually a New York rescue cat. Hello sweetheart, how are you? So So I have a feeling that Beautiful might not be probably as cooperative as what Jess was. She's the female, of course, she runs the household. So she's got less conjunctivitis than what Jessie does. And you can see that in general, she's a lot more healthy at the moment than what Jess is.
Good girl.
We're currently taking 4 pharyngeal swabs and 3 conjunctival swabs of each.
Good girl.
Even taking 1 sample is quite invasive for them. Jessie's a lot sicker than what Beautiful is. So Beautiful actually has a couple of ulcers at the back here. When we see ulcers like this, we know that there's some kind of upper respiratory tract infection. That could be viral, it could be bacterial, it could be a whole bunch of things. Do you reckon that we can have a little sample of that? There. And I just have a little, you don't have to pull it all the way down. Oh, that was good, Kate.
Good job. Good girl. Okay, well done.
What was really helpful with Beautiful is how much she loves food.
Yum, yum, yum.
Snacks?
Oh, yeah?
Yep. Okay, we're on the snacks.
She's such a girl.
I feel like as though that this snack situation is working quite well.
Yeah.
From here is we're just going to make sure that we leave 2 little poo pots so that she can collect us 2 poo samples. Okay, great. We've got everything we need. We've got all the swabs, all the samples. We're going to get them off to the lab this afternoon. Now what we need to do is get rid of this gear, take all this stuff off and dispose of it completely.
On the Gold Coast,
Wow.
That is huge.
Alex and Gerardo have discovered a massive piece of bone stuck in little Monty's esophagus.
We're going to anaesthetise Monty now. Once she's asleep, we can get the camera down and we can see what's exactly down in her esophagus. Right.
I'll inflate it then.
Yeah. Oh, I would inflate it just a little bit. Oh, that's really irritating her throat. All right, sweetheart.
Sweetheart, you're going to have a good sleep now.
That's it. Okay, yeah, she's asleep now. That's good.
What we're going to do is put the endoscope down Monty's esophagus and we're going to have a look and see what's down there. And hopefully we can put some grabs down and pull it out.
So I'm just lubricating the end of the scope so it goes down smoothly. Now she's only a tiny dog. She's only 4 kilos, so there's not a lot of room down there to work with. Okay, here we go. Into the esophagus.
We're in the esophagus now. Okay, keep on going.
There it is.
There it is. Oh, look at that.
Oh my God. Okay, this looks like a piece of bone, doesn't it?
Yeah, it looks like cartilage and connective tissue. Yeah.
It's taken up the whole of the esophagus, so
I wonder why it's stuck. It's huge.
that's going to be challenging. My biggest concern is if the bone that's stuck down there has sharp edges, we're not going to be able to remove it.
The claw.
Yeah.
What we're going to do is pass the claw down into her esophagus and then slowly pull it out.
Slow being the important word there. Even putting this claw down is going to cause some trauma, but we have no choice. We have to get it out.
In Melbourne, vet nurse Terrie has arrived with one of Danny's favourite and smallest patients.
Rupert is a gorgeous 12-week-old kitten that's come in today for a bit of a checkup. Unfortunately, he had a bit of a rough start to life with his first owners and has some really severe injuries that we are managing at the moment, so we'll just see how he's going today.
The strange attachment on this brave little boy is an external fixator, keeping everything in place while his injuries heal.
You see how this leg's looking. So he's dislocated his elbow and he has ruptured the collateral ligament on the inside there, so it's not stable, and that's why this X-Fix is on just to help stabilise that temporarily and be reassessed to see if that elbow is going to stay in place, and if not, then we may need to amputate.
Little Rupert is also recovering from a nasty fracture to his back leg.
So he had a fracture through his tibia as well, so he's had a plate implanted to stabilise that fracture, and that looked beautiful on X-ray as well, so that's really good, and that surgical site's just healing beautifully. No swelling, signs of infection. He's not painful when I palpate along that plate either. You want to see it using that leg nicely, mate? Want to have a little walk around? Here you go, mate. Go have an explore. Hey, good boy. When I met Rupert about a month ago, he was in desperate need for some really expensive surgery. But luckily for Rupert, we have an incredible community of animal lovers who we reached out to, and they really pulled through with raising some incredible funds so that he could have the surgery that he needed. They have saved Rupert's life. Well, mister, I am super impressed with you. Hey? You're just a superstar. Everything's just looking so good. He's using the legs so well. No signs of infection. I'm so happy. Hey?
He's so happy.
Now you just gotta go live a happy, long life now, mister. You hear me? Bye-bye.
Hopefully the fixator will be able to be removed in 3 weeks and Rupert can find a loving home.
You're the best, Rupert.
He's right there.
At the Australian Reptile Park, Tim is playing matchmaker, hoping his 2 endangered cassowaries are ready to mate.
I open the gate, scale the fence. I just wait for Cooper to pass and get out. Gate shut. Yep. So we've got Cooper in Cassie's yard. We'll just leave him sit, hey? Give him 10, 20 minutes to find those eggs, have a look.
4-year-old Cooper is a prime age for mating, so Tim is hoping some strategically placed decoy eggs will convince him that his female neighbour Cassie is ready for some action.
He's had a look at it, a look over it, give it a little peck. That's exactly what I wanted to see. It's now time to introduce Cassie. Shields, Obi, if it goes bad and they're really aggressive, just get in there, get between them, and if we can, we'll try and push Cooper back to his yard.
Yep.
But fingers crossed we get a mating. All right?
Yep.
Okay. 1, 2, 3. Enter Cassie. Got it, gate closed. Cassie's in with Cooper. Righto, it's go time now, Obes and Dean. This is a really calm introduction. You can go from 0 to 100 like that. And we've personally been here before. Everything's rosy like this. And in a split second, you've got Cooper full throttle, just kicking Cassie. And you know, whilst this is a really big enclosure, here she can get stuck. And that's when our job becomes critical.
Come on, bud. Let's go. That's it.
In the wild, cassowaries are solitary birds, only coming together to mate. But courtship doesn't always go to plan.
Even though Cooper is smaller, he will be the aggressor. Worst case scenario from a fight between cassowaries is death.
Come on, buddy.
In Melbourne, Danny is ready for her next patient.
Sit down. That's our boy.
And Tom's just arrived with Doug.
Doug's got a bit of a lesion on his eye. So he had it grow and then we booked him in for surgery and it fell off. So we came back and had it checked and it's going to grow again and again. So he's coming today to have that taken off. It's a boy. A good big dog.
The old golden retriever is a special part of Tom's young family.
He's so special. We had him as part of our wedding party actually when we got married. He had a little tuxedo on and he's 8 years old today actually. And he's just the sweetest dog. He's well behaved, he's very, very sweet, loves a cuddle. He's just my best bud. It's all right, it'll be quick. It'll be a quick one. It's a boy.
Hello, Doug. Hey, mate.
Who's that?
How you going? Hi. Is that lump grown back again, mate? Oh, no. So I hear it's a bit of a special day for Doug.
Yeah, it's Doug's 8th birthday. I booked him in for surgery on his 8th birthday.
Oh, Doug, I'm
Worst
sorry,
dad
mate.
ever.
I'm sorry. We'll take good care of you though today. You'll get lots of love and attention from us. Hey, how does that sound? Is that okay? Oh, okay. It's a deal.
That's a boy.
Doug is such a sweet soul. He's probably one of the best patients. I shouldn't say that, but he is. So the plan for today will be to take that lump off the eyelid and send it off to the lab for testing, just to make sure that it's nothing serious.
Yep, sounds perfect.
And hopefully it all goes very smoothly, mate. Hey? You good boy. All right, you want to say goodbye to Dad?
See you, buddy.
It's not exactly the best way to spend a birthday,
Yeah, Papa. All right, we'll take good care of you.
but hopefully Doug will be back with Tom in no time.
Come on, Pup. This way. Good boy.
Good
See you
boy,
later,
Danny.
Tom.
See you, Danny.
He's going to start and follow her now. This is what typically happens. She'll lead him on a bit of a walk.
So far at the Australian Reptile Park, Tim's matchmaking plan for the 2 endangered cassowaries is going well.
Cooper will follow and get closer and closer and closer. They play this game out for 10 to 20 minutes most times. That's when we either have a mating or a fight. There he is, he's right up on her.
He's getting closer, isn't he?
Bang. The good news is Cooper has calmly sat down in the perfect position on Cassie and they've mated. In a couple of months, could be little cassowaries. And for us now, this is when the stakes rise. They're a little frustrated now because they want to get apart.
The romance between Cassie and Cooper doesn't last long, and this is where things can quickly turn violent.
Can you see him?
Yeah, he's coming right
they're
up.
starting
Oh,
this.
yep.
Hey! Get ready. Hey, hey, hey! Hey!
Tim and his team now have to try to get them apart, so neither bird is seriously injured.
Come on.
Stay there. You right, mate?
Yeah, mate. Come on.
She's pretty good. I'm going to come back down to you. We've got
Come on.
Cassie up in the corner, Cooper down here with Obi. They've just had
Come on.
an altercation, enough that one of them is going to get hurt. Obi's just making himself look bigger than he is. So rather than shielding, he's using the shield and a stick just to make his presence seem bigger.
You ready, mate?
Yes. Go on, mate.
Come on.
This is why I brought Obi out of retirement. He's the cassowary whisperer. Atta boy. Woo. Well done, mate. How's your heart?
I wouldn't like to have a heart monitor on. I think it would blow up.
Yeah, he's fired up. How's she? Is she okay? I might
Yeah,
just go
she's
in.
still up the corner.
For us, that's actually a successful mating. We've had some fighting that thankfully didn't go too far, and now we've got 2 separate cassowaries, and we repeat this again in 2 days' time. That's cassowaries for you. Another day in the office, boys.
Good day.
Good day.
Even putting this claw down is going to cause some trauma, but we have no choice.
On the Gold Coast, Alex and Gerardo are starting the delicate procedure to try and remove a large bone stuck in Fox Terrier Monty's esophagus.
I'm just going really slowly. I just don't want to push the bone further down. There's just no room.
They're using a special claw instrument to try to grab onto the bone without causing any damage to Monty's esophagus.
Okay,
Okay.
almost got it. Okay, try closing down now. Close down. Oh, yeah, you got it. Looks like you got a fairly good bite there. Good job.
Pretty good
How's
grip.
it feel?
Yeah.
Yep.
Watch that esophageal wall, that's not coming with us.
Yep.
I'm coming back really slowly.
Okay.
here it
All right,
comes.
it's coming. It's
Yep,
coming.
yep.
Wow. Good work.
Oh, I can smell it.
That reeks.
Wow, that is a big bone for a little tiny dog.
Good work.
I did not think we were going to be able to get that out, but oh, that's good. Good news. We just got to go back down and see what damage is down there now.
Yeah. Or we know that bone may have been stuck there for 12 hours, 24 hours. So to make sure there's no ulcerations or no necrosis of the esophagus. Okay. though. Whoa.
Oh, wow. Yeah, that's ulcerated. That would be so painful.
Yeah.
The ulceration is due to having a large object, the bone, stuck in her throat for a long time.
It's no wonder the little dog has been gagging and struggling to breathe.
So we're going to wake Moni up. She should be on medication to deal with the ulceration. The most important thing is that she can eat, so we need to keep her comfortable and protect her throat as it heals.
Moni will be monitored for a few hours and then hopefully be well enough to go home with her relieved owners.
This is a really good result. It could have been a lot worse for Moni. She must have been in so much pain, and she's really come through this procedure very well.
Wow.
Mobile vet Audrey is making a long-distance house call today near Canberra.
Very excited to see 20 or so patients there, just checking in on them today.
Audrey's meeting up with Rosemary at the busy Possumwood Sanctuary to check up on some extra special patients.
Hi, Rosemary.
Oh, hi, Audrey.
Nice
to see
you. Rosemary and Steve are the owners of Possumwood. They've been rehabilitating wildlife, looking after kangaroos, and they've been doing this for over 20 years, which is amazing. Their role in the recent bushfires has been so important for these guys to recover in a safe place.
Ready for a nice busy weekend?
I am. How are my girls going?
Oh, the girls are pretty good. As soon as the fires hit, we very quickly accumulated a lot of animals with severe burns. Audrey has been a godsend to us. Come to say hello to her. Having a vet come here, it has made our job so much easier because it's very difficult. You can see she loves animals, and that's very important to Steve and I, that we have a vet here who actually loves the wildlife.
Home sweet home. Hello, Cinders. Hey, Rusty.
At Possumwood,
Hey, Pouchy. How are you going, my girl?
the animals get loads of TLC, including free run of the lounge room.
Looks like everyone's here today, so we might as well get started. This is little Hawthorne. He's about 8-9 months old, we think, and he was found trapped in a fence by one leg. And usually when they're hanging from one leg, they can do quite a lot of damage because they're flailing around trying to get out. So he's got quite a deep wound just on his foot there that we're dressing, but also we feel like some of the nerves have been damaged. Hey, Reese. Here's Hawthorne.
Hello. How you going, Hawthorne?
A little boy fence hanger.
Audrey and animal rehab therapist Reese have been working together to treat these injured and traumatised little patients.
Reese is going to do some laser therapy on him, and we're also going to resplint that leg and just see how everything's going.
So I've got a little pair of, well, they call them doggles. They're for dogs, but in this case we're putting them on kangaroos to protect his eyes from the laser. There we are. Johnson doggles too, Audrey.
Oh,
some
fancy.
for you. Some for
Why
you,
does
Bree.
he get fancier ones than me?
It will be a long road to recovery for brave little Hawthorne, but everyone is hoping one day he can go back to the wild.
All right, so we'll just take off that last layer. So we got a blob of honey actually there. So we're using the honey quite a lot if we've got deep wounds to help it granulate and heal. It's also really good at keeping infection away. Last week when we had a look at this wound, it was quite deep and we could actually see through to almost the tendon, but that's sealed over quite well just from the Manuka honey, and it's actually got fresh granulation tissue in there. So we're pretty happy with how that's healing. And I guess we're just gonna have to look at how he's moving this toe, which was the concern last week.
The laser enhances the body's natural ability to heal, so what we're going to come up with is faster healing times for the injuries.
With any leg injuries with kangaroos, it's so important to fix it and fix it fast because overall they only have 2 legs and a tail to move around. And if they stop using that leg, they can put a lot of pressure on the other one.
All right, all done, mate.
Take off your cool goggles.
Oh, how's that?
Oh my God, he's so cute. Oh, there we go. Hopefully he does fully recover and we can get him back to where he came from, because the sad story is we did have to take him away from his mum when he was trapped in the fence, and he still does call out for her quite a lot. That's his mummy cry. So if he heals up, we can get him back and maybe he can find his mum again.
Okay, a bit noisy, Oh boy, mate. Oh boy.
In Melbourne, Danny is starting surgery preparations for birthday boy Doug, who's having a lump removed from his eyelid.
Just got to give it a bit of a clean. I've just got to clean it, I promise. Just got to clean, see? Scrub, scrub, scrub. So we've seen Doug before and he has had this recurrent issue with the lump on the eye. It tends to grow and then fall off and grow back again, and it is irritating the surface of the eye. So the plan is to remove that today. Very brave. All right, now we're just going to get some bloods from you now, okay?
A quick blood test will confirm if 8-year-old Doug is okay for anaesthetic.
So no concern on bloods today, which is great. So birthday treat for Doug, it's surgery today. All right, mate. I'm gonna go nice for a little bit.
All right, now we're going down.
At 8, Doug is considered elderly for a dog, so anaesthetic will be the biggest risk. And just moments into the procedure,
come on, mate.
Danny is concerned.
And take some breaths, mate.
As the seconds tick by, Doug still isn't breathing properly.
Take a breath, mate.
Come on, Papa.
At Possumwood Sanctuary, Audrey's next patients are mother and daughter, Indiana and Nino.
There you are, Indy and Nino. Big day for Indy and for all of us. She was actually a bushfire affected girl. Nino's her little Joey. It's the final check before we see whether she can go to the outdoor enclosure. So that'll be the first time she's allowed out without bandages. Indiana came in at the very beginning of the bushfires. She was actually in another sanctuary where they have a big enclosure for kangaroos, and a massive fire roared down the mountain and actually hit the enclosure. And she is a very protective mother. So she ran back through the enclosure just straight into the fire to try and find Nino. You can actually see her ears are completely singed. They're all kind of crinkled at the top, and her eyelashes were all burnt off. Indy's feet were probably one of the worst. They were completely burnt on the underside, down to pretty much tendon. So you can see that the bottom of the feet have healed really, really well. We're very happy with that. And I think, you know, clean bill of health, so she gets to go outdoors today. Indiana is the biggest couch potato you'll ever find. She and her Joey permanently stay on the couch. They just love it. Oh, look at that. I'm hoping today she tries something different and has a bit of a one day outdoors for us. I think if we move Indy, because Nino's attached at the hip, he'll just follow.
With Indy and Nino looking a bit too relaxed, Audrey's going to need some help from vet nurse Brianna.
This way, this way. She just loves her couch. Stop being a couch potato. We got to go outside to the sun at some point in your life.
These girls aren't too keen on giving up their very comfy couch.
It's definitely harder herding kangaroos, especially kangaroos that love couches.
They're not cooperating today.
Why don't you carry Nino and I will coax Indy.
All right, Nino. It's been a long journey, but here we go. Let's go.
Come on, Indy.
Look.
There we go. Yay. You get Nino. As you can see, it was so hard getting them off the couch because she's turned into a big couch potato. It's so nice and warm in there. It's so great just seeing her jumping and hopping. She's come such a long way, and to have her baby with her the whole time has been great.
It's hoped the next adventure for these very brave girls is back in the wild where they belong.
Hi, Mama. Good girl, Indy.
Kate has returned to Bondi after a house call to test 2 cats for the deadly coronavirus.
Hey Graham, I was just calling about the 2 coughing cats that I sent off the PCRs for the coronavirus test. The worst thing that can happen for Jessie and Beautiful is that these 2 cats test positive for COVID-19. I'm really hoping that this isn't the case and these tests come back clear. Oh, Kato.
Yeah.
I've got the results of this coronavirus test for the cats.
Okay.
Turns out it's come back negative.
Okay, that's good.
But these two pampered pets still face some serious health issues.
These cats are absolutely beautiful and they're obviously really well loved. The only thing that we do need to deal with is that both of them have quite a bad pneumonia and we do probably need to put them on some antibiotics. So this is a really good result and I think these guys are going to be back to normal within a couple of weeks.
Oh, good girl.
Come on, mate.
In Melbourne, Danny's patient Doug still isn't breathing at the start of his eye surgery.
You want to take some breaths? Some dogs are more sensitive to the anaesthetic drug that we use, and a side effect of that is that they will hold their breath. But certainly it is a bit more nerve-wracking when they are an older patient, so come on, Doug. It's time to start breathing for yourself, mate. Hey?
After a few anxious minutes, 8-year-old Doug finally starts breathing.
Okay, Dougie boy. Let's take you through to surgery, mate.
Danny can now begin surgery to remove a lump on his eyelid.
You know how annoying it is having something rubbing on your eye permanently, and poor Doug's had that for quite some time, so it'll be so good to remove that irritation from him.
Doug's lump removal should be straightforward.
Okie dokie. All set.
And Danny is anxious to keep him under anaesthetic for as short a time as possible.
I want to make sure that I get appropriate margins, so we need to get the entire mass out. It is a bit tricky and delicate when you are so close to the eye, but we do have instruments to protect the eye whilst we're operating in that area. It's not a very large mass, but even something as small as that can cause serious trauma to the eye surface. And the mass actually does extend up into one of the glands of the eye too, so I think he'll be much more comfortable without this there.
The lump will be sent off for testing to make sure it's not cancerous.
So the tricky part's all done. Just a few more stitches to go, and then you'll be as handsome as ever, little Dougie. Fingers crossed Doug doesn't get any more growth like this. Golden Retrievers are quite prone at getting growth on their eyelid, so we'll have to keep a close watch on that in the future. Oh, Doug. Hey, you sleep that off now, mate. You'll be as good as new. Yes.
Four hours later, Tom's arrived to take his birthday boy home.
Oh, he's got a birthday hat.
Danny's determined to send Doug home in style.
Oh, good boy.
That's a boy. It's always a very excruciatingly long wait to get the phone call to let us know he's okay.
Hi.
Oh.
How are you, buddy? Oh, you look so handsome.
Hey, mate. The best time of the day is definitely handing back a beautiful, happy dog like Doug to his loving owner, Tom. There you go, party time.
There we go, Dougie.
Party time, Papa. Hey, it's your birthday party now. The surgery's gone really well today. I'm really happy with how that eyelid's come back together. So we'll see you back in a few days just to make sure everything's looking really good.
Awesome.
It was so nice to take care of Doug today. He's such a sweetheart.
Thanks for making his birthday so special.
Oh, well, we tried. I'm sure he'll be happy to get home though. All right, mate, will you go enjoy the rest of your birthday? Hey, Dougie boy, I'll see you soon. Okay, mate. Bye. Bye. See you, Doug. Happy birthday, mate.
All right, buddy. Let's go. Good boy.
Hey, what an adventure.
Little fox terrier Monty has fully recovered after getting a large bone stuck in his throat. From now on, it's definitely chicken without bones on Monty's menu.
Hey!
Those fiery cassowaries successfully mated a second time, and Tim's now hopeful there'll soon be cassowary babies at the reptile park. And great news for little Rupert. His damaged leg is healing well, and he's been adopted. Danny's vet nurse Terrie fell in love with the brave battler and has given him his forever home.
We absolutely adore him, and he's just fallen in love with our newborn son. So we've got 8 babies, 7 fur babies, 1 human. Glad we kept Rupert, otherwise it would be uneven, so it's good.